What's going on, guys? My name is Steve. Thank you for stopping by my channel. Today, we're going to be reacting to establishing the UK's National Health Service. Before I started this channel, I didn't know anything about the NHS. Obviously, I understood that you guys in the UK had universal health care, but beyond that, I didn't know anything else about it. Since then, I've reacted to a few different videos about the NHS, and I've learned quite a bit about it. I've learned kind of how it operates, and I've learned that a lot of people, or most people throughout the UK, really enjoy the NHS and they prefer that type of healthcare system. And so I've become very interested in this topic because it's something that I don't really have any experience with, and I find it kind of fascinating because it's a completely different healthcare paradigm between the US and the UK. But anyways, guys, I came across this video and I realized I've never really learned about the history of the NHS and kind of how did it come about? How long's it been around? How popular was it when it first got started? And, all sorts of different questions like that. But anyways, guys, don't really know what to expect here, but that's what I'm thinking this video is probably about, establishing the UK's National Health Service. That sounds like basically the beginnings or the history of the NHS. So anyways, guys, I'm excited about this video, so let's just go ahead and dive in and check out establishing the UK's National Health Service.
Nationalised healthcare. It's a bit of a conversation starter. Your opinion on those two words will likely depend on where you're from, and we can probably simplify things further by saying whether you were born in the United States or not. The furor that surrounded the Affordable Health Care Act, otherwise known as Obamacare, which came into being in 2010, highlighted just how divided Americans are on such an issue.
Very divided.
But for the rest of the world, it's simply business as usual. While national healthcare is one step short of full-blown communism to many Americans, in many areas of the world, it remains a cherished, important part of society. And there is no clearer example of this than with the United Kingdom and its National Health Service. It's like, yeah, I'm pretty far away from being a communist, but I'm grateful that, of healthcare. If we could move back to the days before COVID-19 and ask the UK's general public about their opinion on the NHS, you'd likely receive two responses in one. The first would be a general grumble regarding budget cuts and waiting lists, but this would invariably be followed by a staunch defense of an ideal that, even though it's faced difficult times, has been a foundation of the nation since its inception in 1948. If you grew up in the UK like I did, you've almost certainly come into contact with the NHS and its legion of workers who, believe me, they're not in medicine for money. The COVID-19 crisis has added yet another layer to this complex story, as those workers suddenly found themselves in the trenches in the early struggles as the pandemic swept across the country. The idea of healthcare and how we pay for it has never been in sharper focus. Before we dive in with regard to the NHS, it's perhaps important to first highlight the differences between these two different styles of healthcare. This is a highly contentious issue with supporters of both sides struggling.
I want to see this real quick. Countries are free and universal health care. Countries are free or without free or universal health care. The US, what is that? I don't even know what country that is. I'm not sure what this is. This is Brazil right here, so I have no idea what country that is. Bunch of countries in Africa. Wow. What are the blue countries?
To see the benefits of the other, but of course each system must have some redeeming qualities, otherwise they simply wouldn't exist. As I previously mentioned, the USA is the only developed nation to still predominantly use private healthcare. The ACA may have shifted things a bit, but in reality it's still a million miles from full universal healthcare. So, well, what's the difference, and why do people prefer one or the other? Universal healthcare means that everybody has access to medical coverage which is paid through taxes, while private healthcare is paid for by individuals or their insurance policies. Countries with universal healthcare typically have some sort of private healthcare market should residents want broader coverage, faster access to care, or benefits that a private marketplace can provide. The benefits of universal healthcare include lower overall costs, especially with the price of prescription drugs and administration costs.
Definitely learned that. I don't really take any prescriptions, but I can imagine if I did. I think in the UK, you guys, I heard it was like max of like $9. What was it, $9 a month or something like that? It was insane. It's like, wow, it's really cheap. I know when I've had to get a prescription in the past for something, I don't even remember the last time I did, but you're talking hundreds of dollars in a lot of cases. So definitely, even someone who hasn't really don't really take prescription drugs for anything has seen how hard it could be if someone needed prescription on a regular basis in the U.S.
In theory, this should also cut out unnecessary spending, but in the wrong hands, this could morph into cutting corners. On the flip side, universal healthcare often sees longer wait times for both seeing a doctor and outright surgical procedures. Healthcare budgets can sometimes balloon out of control, and with a steadily aging population, it's not entirely clear how this is going to work in the future. Like any kind of socialized initiative, it also faces the argument of why healthy people should have to pay for other people's medical costs. Private healthcare typically does provide an excellent standard of care as long as you can afford it. Many of the best doctors in the world work in the US system, which often attracts both wealthy foreign nationals and Brits or Canadians disillusioned with long wait times.
That is one thing that I've noticed when I've looked at the comments and in my own experience. I've had really good experiences with healthcare in the U.S. You know, I don't have any complaints really, but the cost is insane. That's the big deal. You know, I think you can get great care here. It's just the cost is a huge problem. And you know, I think that if people would be willing to talk to each other, you know, on both sides of the aisle, there could be some sort of, you know, negotiation to where both sides could win a little bit, but no one will talk to each other and kind of try to figure out how to solve this issue. They both just want what they want and they're not willing to budge. And that's not the way to ever move forward with anything.
Current data suggests that the average monthly cost of US medical insurance is north of $400. While that number might leave European citizens gasping in shock, it is worth pointing out that American tax rates are often much lower than they are in Europe. So while you're paying insurance premiums each month, you're paying less taxes. Generally. Private healthcare also gives you greater choice of care and access to a wider range of treatments and drugs. Cost is the quite obvious negative to privatized healthcare systems. If you can afford it, it's certainly great, but many people can't, which is a proposition that's further complicated by American tendencies to tie health insurance to full-time jobs. For those that can't afford it and don't have a job that provides health insurance, healthcare can become very difficult indeed. The average cost of the non-surgical treatment of a broken arm or leg is about $2,500. It's currently estimated that between 25 and 30 million Americans don't have insurance, and around 75 million people receive Medicaid, a government-run plan to provide basic medical coverage to low-income families.
Right. You know, I can definitely attest to that. I was just looking at some older medical bills from my wife from a few years back, and it was $1,350 a night just for her room. Okay. I don't even remember what the whole bill was, but you're talking about, you look at the itemized bill and like a vitamin C tablet, you're being charged like $1.50 for. Okay. That might not seem like much, but you add in how much of these different pills and drugs, and the drugs, oh man, goodness, you get one tablet, it's like $100. You get a bandage, you know, itemized bandage, it's like $50. And that's the problem. It's not the quality of healthcare. The quality of healthcare is great for the most part. There's going to be places in the country, obviously, because every state is different, that isn't going to have necessarily great quality care. Some hospitals are going to be worse than others. But as a whole, the healthcare system, the quality of care, I can't complain with. It is the cost. That is the problem. And like he said, if you're wealthy, if you have the ability to afford this high quality healthcare, you have no problems. I mean, it's great. But it's a lot of people out here, especially, you know, like me, for example. I have to pay for my own health insurance. And so, you know, that's been a problem, you know, it really has been. But yeah, what are you going to do? You just got to live in the system you live in, right? And I don't mind the quality of care, like I said. It really is the cost. It really is. That's it.
Pregnant women, the elderly, and people with disabilities. Now, things would be quite straightforward if private healthcare could guarantee better care, but unfortunately, That's just not the case. At the moment, the US spends more on healthcare per capita than any other country in the world, and by a pretty wide margin, according to the World Health Organization. American healthcare costs come to $10,246 per capita, while in the UK, France, Germany, and many other peer nations, they report figures that are less than $5,000 per capita. And as I said, the extra spending doesn't translate to greater health. In terms of life expectancy, the US ranks 44th in the world, just below Cuba. The UK sits slightly higher at 29th position, with Hong Kong and Japan leading the way. The US also has a child mortality rate of roughly 5.6 per thousand births, according to the WHO, which is almost twice as much as countries like Australia, Germany, and Singapore. This is a debate that still has plenty of distance to it, and one that is probably not going to go away anytime soon. But let's set this aside for the moment. Now that you've got some context on nationalised versus private, let's take a look at the UK's National Health Service. While Britain emerged victorious from World War II, it did so as a shattered nation. Cities lay in ruin, thousands were homeless, and the rationing of food was to go on until 1954. Winston Churchill and his Conservative Party were booted out of power in the 1945 general election as the Labour Party swept into 10 Downing Street. The controversial novel The Citadel, written by A.J. Cronin and released in 1937, was an early touchstone to highlight the glaring drawbacks of Britain's healthcare system before the war. Many of the ideas in the novel would eventually be incorporated by the Labour Party in the creation of the NHS, but this was just one of many reports, papers, and books that had appeared since the start of the century, which called into question Britain's way of handling its healthcare. But the UK had already caught a glimpse of what national healthcare might look like during the dark days of the Second World War. The Emergency Hospital Service had been established in 1939 to provide healthcare to the victims of war, with 2,378 hospitals included and 68,000 beds provided in just London alone. Now, this was by no means the sort of comprehensive coverage that we see today, as it was very much a loose collaboration of hospitals and healthcare professionals sharing resources. Now, fortunately, the number of those who were injured during the bombing raids was actually lower than expected, but the EHS still provided a level of healthcare that just didn't really exist before the war got started. As the fighting ended, things reverted to normal. Britain's 2,700 hospitals at the time were either run by charities or local councils, and only those with certain jobs were provided with free healthcare. The NHS was officially formed on the 5th of July 1948 at Park Hospital in Manchester, but came after years and years of hard work. Now, I should add that while there was a change of government in 1945, Winston Churchill's party leaving, the previous Conservative government...
1948. So, where are we at? So we're talking 73, what do you say, May 1st? Is that what day you said, May 1st? But so... We're talking 73. So someone who is 75 years old right now has basically never known, anybody that age or younger has never known, that lives in the UK, that has never known life without universal health care. Wow. That's a pretty good track. Like, that's a pretty long period of time. I thought it was probably going to be created in the 60s or something. So, yeah, that's interesting.
Had laid much of the foundations for the NHS. On this summer day in 1948, hospitals across the land, doctors, nurses, dentists, opticians, and pharmacists all began working together for the first time. When it launched, the NHS came with three core principles. 1, that it meets the needs of everyone. 2, that it be free at the point of delivery. And 3, that it is based on clinical need, not ability to pay. In reality, things had started even before then, and by day one, an estimated 94% of the British population were already signed up for the service. Now, it's easy to recall the national pride that the service eventually became, but the truth was, it faced severe criticism in the lead up to the 5th of July. The main doctors' union, the British Medical Association, were vehemently against the idea right up until its launch, along with sizable portions of both the Labour and Conservative parties. Most of the misgivings came down to the belief that local councils were more adept at running local healthcare services than the giant overlord that was the country's central government. One memorable quote came from the extremely rich and privileged Lord Horder, who famously proclaimed the Society of Individualists in 1948, and yes, that is the real name of a society, if medicine were taken over by the state, it would be as disastrous as the domination by the church in the Middle Ages, a greater disaster because the church was cultured. And yes, that's also a real quote, apparently. But while some remained against it, they could not prevent the momentous events in 1948. On the 5th of July, a young girl by the name of Sylvia Beckingham was admitted to hospital in Manchester to receive treatment for liver problems. No doubt the young 13-year-old had absolutely no idea of quite the importance attached to her visit to the hospital that day, but Sylvia Beckingham became the first person to ever be treated by the new NHS.
Wow.
And so began the NHS's bumpy ride to its current position. Its first-year budget was recorded at £437 million, roughly £15 billion today, and while it must have been a huge relief to millions, the complexities that came with balancing the books meant that it soon ran into financial difficulties. In the first few years, spending quickly overshot what was being predicted, with Prime Minister Attlee even going on the radio to plead with the nation not to overuse their fledgling service unless they really needed it. There's still some debate about the cause of the problems in these early years. If you want to take the hardline and somewhat classist opinion, you would say that the poor began stripping pharmacy shelves and filling their mouths with fillings that they didn't really need. Alternatively, and perhaps slightly more logically, was that, of course, costs skyrocketed because a huge percentage of the population had never got anywhere near having such options.
I can also imagine that, in the early days, you probably went from people not having easy access to healthcare in general, especially coming out of the war, right? So a lot of issues that could have been resolved earlier, they didn't have access to healthcare to be able to resolve those issues. So all of a sudden you have access to healthcare that you don't have to pay at the time of service for, and you're able to go and get all these problems taken care of. So I can imagine that there was like a backlog of health issues that people were finally able to get seen for. And I think that probably put a strain on the system to begin with as well, I'm guessing.
So many people living without the correct glasses, a mouthful of mangled teeth,
Right.
or health conditions that weren't life-threatening, you begin to see why the initial years saw such a big surge.
That makes sense.
In the early
Yeah.
1950s, prescription charges were brought in, although they remained low at 1 shilling per prescription. That's about £1.50 today. Like most countries tend to do, the UK seesawed back and forth between a Conservative and a Labour government over the coming decades. As the Conservative Party gained control in the 1950s, it faced a difficult decision. Ideologically, they were opposed to the NHS, but the service remained hugely popular across the country. A committee was commissioned to see whether this was the best form of healthcare. The resounding answer was that yes, it was, and the NHS remains mostly untouched. Over the years, the NHS has seen its fair share of ups and downs. The 1960s was a relatively prosperous period, but with healthcare costs soaring, it once again ran into difficulties during the 1980s, not least in the shape of the formidable Margaret Thatcher. But again, even though the Iron Lady and her government may have been
I have got to learn about Margaret Thatcher. I know of her name. I saw someone sent me a short clip of her, and she was being interviewed, and she was like a bulldog in that interview. I don't know anything about her really, but she seems like she's a fairly interesting person, and I know of her name even before starting this channel. So definitely someone I need to dive into and learn about.
Ideologically opposed to such a system, they refrained from making any sizable changes to begin with. She even made the famous statement in 1982 that the NHS was safe in our hands. But things slowly began to change. Firstly with management processes, but by the end of the decade, with costs reaching uncomfortable levels, the Thatcher government introduced the internal market, which split the purchaser from the provider to encourage competition and increase efficiency. In a nutshell, this meant moving at slightly slightly further towards the American model, in which hospitals could compete with one another and receive greater rewards for their work, known as payment by results. Tony Blair swept to power in the 1990s, promising to disrupt the internal market, something he never did, while the first 2 decades of the 21st century have seen massive increases in healthcare costs, coupled with one crippling recession and another one playing out as we make this video. And that's before we even get to COVID-19. The life of free universal healthcare apparently is never an easy one. Since devolution in 1999, the process which transferred much of the power from the main government to smaller regional governments, the NHS has become subdivided into 4 home nations. So you have NHS England, NHS Scotland, NHS Wales, and NHS Northern Ireland, with each operating in a slightly different way. All offer the same basic services, but the biggest differences come with prescriptions. Scotland and Wales offer free prescriptions.
Oh, yeah.
In Northern Ireland, they have a means-tested charge.
I've heard that in the comments.
Free social care service to over 65s, while the rest of the UK does not. From the top of each of these organizations, they are subdivided below based on geographical areas. If we take NHS England as an example, these are known as Clinical Commissioning Groups, CCGs. From there, various organizations below it provide a wide variety of care, but all fall under this same umbrella. These include acute trusts, which provide secondary care within the NHS, treatment centres, the Ambulance Service Trust, NHS Care Trust, which provides both health and social care, and the Mental Health Trust. Slightly outside of this lies the NHS pharmacies, dentists, and opticians. While the names might change slightly, the same rough structure is used all across the UK. The NHS is currently the 5th largest employer on the planet, with a staff of roughly 1.4 million. If you're interested, and I imagine you are, the US Department of Defense, the Chinese Army, Walmart, and McDonald's all place higher. It draws this number from far and wide, and in 2019, 13.4% of NHS workers were from outside of Britain, while the number of doctors was 28.4%. For the fiscal year 2018 to 2019, the NHS budget was a hefty £129 billion, and that is a number that is only going one way. Spoiler alert, it's not down. It's difficult to give any accurate figures right now because of the COVID-19 pandemic, but even if that hadn't happened, the budget would have likely grown by a minimum of £5 billion. The vast majority of funding for the NHS comes from general taxation, with a small additional amount made from national insurance contributions, which every adult in the UK pays. One benefit of the system is that there is next to no billing, which saves enormously on administration costs.
That's true, yeah. I hadn't even thought about the administrative aspect of this. That's true.
To the British people, the NHS is both a source of frustration and also immense pride. It's a service that has gone through some truly difficult times over the years, but it's always managed to battle through. The COVID-19 pandemic has shone a light on the NHS, probably more than ever in recent years, but while it has remained relatively stable, it has highlighted huge deficiencies that have come from years of underfunding. Maybe we've all taken this grand old lady who reached 70 in 2018 for granted. It's difficult to say where we go from this point. Logically, you would say that the NHS will receive a massive spending boost that it deserves and we can all happily continue as normal, but that will most likely depend on how deep a recession the UK lands in post-pandemic. You would think that healthcare would be prioritized after the biggest healthcare crisis of the modern era. But who knows, when business and money become involved, sometimes the less viable, more expensive options get missed, which is exactly what has happened to the NHS over the years. As if this wasn't difficult enough, the NHS will also need to grapple with the booming cost of medicine and, as in many parts of the world, an aging population. Currently, 18% of the UK's population is over 65, with that number expected to rise to just over a quarter in the coming decades. We're living longer than ever, which is great news, but it does come with an economic conundrum. Whatever you might think about universal healthcare and an organization like the NHS, it's difficult to detract from the 1.4 million people who currently work for it. From the doctors and nurses to home care workers and rehabilitation specialists, these people have not entered medicine for the riches, but instead chose to work for an organization that, though it may be deeply flawed at times, stands for an ideal that the British remain proud of, that medicine should and must be free to all. So I really hope that you enjoyed that video, no matter what your opinion on the subject. We hope to cover what the NHS was rather than be too divisive. If you did enjoy it, please do hit that thumbs up button below. Don't forget to subscribe. Also, if you got a suggestion.
Wow, that was probably the most informative NHS video I've seen yet. I've seen a couple of them, I don't know, 2 or 3 of them, but this just went the whole, from the, it talked about private healthcare and universal healthcare. It talked about the beginnings of the NHS plus what's going on with it now, sort of, and everything in between, really. So it was a little bit more to this video than I even thought it was going to be when I started it. One thing that I think everybody has to be concerned with, and this obviously isn't just an NHS problem. This is a problem in pretty much all, first world countries for different reasons. But people aren't having babies as much as they used to, and that's going to be a problem. It's going to be a problem. It already is showing up as a problem, and it's just going to get worse if people do not start having more babies. As people age, we're going to have a larger and larger older population as the coming decades get here, and we're not going to have that large group of younger people paying into these systems. The NHS, specifically because of this video that we're reacting to, but also in any sort of social system, social nets, even in the US, which doesn't have universal health care. It's definitely something to keep an eye on, and it's going to be interesting to see how these governments, and in this case specifically the UK, battles this issue. Obviously, a lot of people say that we'll bring in younger people to work, but there's going to come a point that might not even be enough. There's got to be. I don't know. I don't know what the answers are going to be, but it's going to be very interesting to see. But I thought this was a really awesome video, and it definitely helped me understand the NHS on a deeper level. I'm honestly surprised that it's 75 years old this year. I thought it was younger than that. It sounds like it's had its ups and downs, but because the British people tend to really enjoy having the NHS, they've somehow battled through these ups and these downs, and were able to keep it going. And I hope, I hope you guys can continue enjoying the NHS for what it is today. I still want to learn more about it. I still want to learn kind of more about what the wait times for different things are, and kind of just more about what I've learned about what a lot of the positives about the NHS are, but I also want to learn about what are some of the negative drawbacks to it. Obviously there is pros and cons to every topic, and the NHS is, no different. I'm sure there's obviously reasons people don't like the NHS, and I don't really understand all the reasons why. Outside of a few, I've heard that obviously some people talk about the waiting times in some cases can be much longer than a private system. Some people feel like maybe maybe they pay more into it than they would like if they make a lot of money, and all sorts of things like that. Maybe, I don't know. I'm just curious. So I'll have to look into that and try to find some other videos that'll go into more detail about some of the nuances of the NHS, if you will. But anyways, guys, thank you so much for stopping by. Please click that like button. Feel free to drop your comments or suggestions about this video or others. And don't forget to subscribe to continue to follow me on my journey to discover my British and Irish ancestry. Until next time, guys, peace.